I want to introduce the next fireside chat, which is going to be with the newly appointed California Surgeon General, Diana Ramos, to discuss the many public health challenges that we've all heard about over the last several years, but also opportunities facing California. Diana is going to be in conversation with Dr. Louise Aronson, who many of you will recognize whether you're a regular reader of the New York Times or the New England Journal of Medicine. Dr. Aronson is a leading geriatrician, a professor of medicine at the University of California, San Francisco, as well as the author and writer of the New York Times bestseller and Pulitzer Prize nominee, Elderhood: Redefining Aging, Transforming Medicine, and Reimagining Life. And if you haven't read it, you really should, and I don't make those recommendations lightly. What I loved, Louise is a fifth-generation San Franciscan, and I read in her bio that at one point she wanted to be a professional basketball player, and I think we have all benefited from the fact that that maybe didn't happen. So, but she really has been at the front line in understanding many of the issues that she and Dr. Ramos will be discussing. I'm going to turn it over to you guys.
Thank you. All right. Good morning. Good morning. So, hi everybody. I have the great honor of talking to our newly appointed as of September 1st, or newly started as of September 1st, Surgeon General. Dr. Diana Ramos not only has an MD, I learned, but has an MPH, so Master's in Public Health, and a Master's in Business Administration. So already one begins to see why she was chosen for this role, but she's also worked across industries, as a clinician with government locally and at the state level with industry. And before taking this job, you were the administrator for the Center for Community Living for the California Department of Public Health, which also seems really apropos. But I thought we'd get started by just talking about what is the California Surgeon General? What is your role? And just start with the basics.
So the basics is that in 2019, Governor Newsom created the Office of the California Surgeon General. And it really codifies the importance of health in California. The way that I look at it, and I thought about it, every single state in the nation has an attorney general. Why not a surgeon general? It just really stands out that health is critically important. So Governor Newsom created the position in 2019, and really to serve as an advisor, a public health voice, somebody that can really bring in experience and provide input in developing solutions for the critically important issues that California is facing. We are the fourth largest economy in the world. And so as that, why not have a position that really codifies health?
I love that. The analogy to the Attorney General clarified it hugely for me. I hadn't thought of that. So one of the topics of this conference is really thinking about a longer, healthier lives. And I wondered what you or your office or both are thinking about to extend the health span of Californians and maybe tackling it across the current lifespan.
Yes, so you mentioned two key words, lifespan and extending life. And those have been some of my issues throughout my career that I focused on. One is really improving the quality of life, because it's not just enough to be alive, but if we can be really alive, enjoying the quality of health, physical, mental, emotional, you've got it all. And the other is the whole lifespan. And so throughout my entire career, I've focused on how can we improve life along the whole trajectory for someone. And some of the initiatives start really with preconception. I heard some of the speakers earlier talking about before you become pregnant and just having the healthiest physical being that you can possibly be. and to help you decide when you want to have a child, if that's your choice. One of the things that I've learned along the way is that there are things that impact and experiences that impact our life. Dr. Wallinger, in the first presenter this morning, talked about resiliency, right? And all of these negative impacts that many of the World War II children had experienced. And when I was listening to him, I thought, wow, he's talking about adverse childhood experiences. And that's, we just renamed it. And we've actually had adverse childhood experiences, looking at those results. And now I'm thinking, I want to go look at the results of those studies, because that's going to give us a lot of insight. But looking at how can we look at those experiences when we're children, when our mothers were pregnant with us, if there was trauma, if there was toxic stress that they experienced, all of that really changes the life course of us as people. So really improving the life course, the lifespan so that everyone has the healthiest opportunities to being the best person that they can be is really something that I'm very excited about. And my office is working on the adverse childhood experiences.
That's terrific. I realize I forgot to mention that Dr. Ramos is an obstetrician gynecologist, so apologies for that. And I don't usually think of that as having a lot to do with aging necessarily,
There's a lot to do with aging.
Exactly. So I'm seeing more and more. Generally, I'd like to joke that the children of my patients are postmenopausal, but in thinking about adverse childhood experiences, we do think, okay, aging begins maybe in utero. But I'm seeing people now in their 80s and 90s, and their ability to cope with the pandemic seems to correlate in some not insignificant part with whether they had what we now call adverse childhood experiences. So when you first hear that, you might think the focus isn't affecting aging and the lifespan, but it absolutely is. So such a terrific focus for your office.
Absolutely. And I just want to share, you had mentioned prior to becoming Surgeon General, I was Assistant Deputy Director for the Center for Healthy Communities. And one of the programs that I oversaw was the Alzheimer's program. And I learned so much. And I realized, okay, a lot of things are happening with two-thirds of Alzheimer's patients being women, and the number of Alzheimer's patients that are going to be increasing by 2030. 1 in 6 people will have Alzheimer's in California. I thought, where can we prevent this? And I pulled up the Lancet Commission in 2020, put out a fantastic report, and I saw the areas to decrease your risk for dementia and Alzheimer's is in the 40s and in childhood: increasing education, decreasing smoking, decreasing obesity, decreasing asthma. And I looked to see those are the same things. If you were to address adverse childhood experiences, those are the same things that will decrease your risk for dementia and Alzheimer's. I thought, wow, what a common denominator. And so that really excited me, because I saw, okay, by focusing on adverse childhood experiences, we are really impacting not only the chronic diseases, but everything else as we get older.
Yeah, so true. And the Lancet also talks about exercise, and apropos the previous presentation, healthy food, which makes a difference whether you're, 8 months old or 80 years old. So more evidence that across the lifespan, the same things help, and the things that we can do to help communities will help people of all ages. Which sort of segs somewhat into our next topic of mental health, another focus of yours. And can you tell us a little more about how you're thinking about that across the lifespan, and whether pandemic experiences, which varied so much by generation, influenced that?
Yes, so we have all, and I say we have all been impacted by COVID. And we know that prior to COVID, 1 in 5 people had mental health, was impacted by mental health issues. And COVID just really, I like to say, pulled the curtain on everything that was happening. The fact that people of color are disproportionately more impacted with mental health issues. The fact that 36% of Hispanics who have mental health issues do not get the help that they need, compared to 46% of the general population. Children are impacted. The elderly, 37% of Medicare Hispanics reported having a mental health condition, compared to 21% of the white population. So really, it just pulled the curtain on, we need to continue focusing on mental health conditions, because it really connects with everything else. It goes through depression, connects with depression, with isolation, with all of the health that we're in, the mind body connection. And I am just so pleased to say that Governor Newsom has invested over $4.7 billion to improve, to reimagine what healthcare is going to, mental health care is going to look like and should be looking like. The focus is from 0 to 25, but that's not to say, and you have to remember, it's those starting in childhood that really is going to set you on that healthy life course, lifespan, as we all get older. So, and mental health, I'm just so pleased that my office is taking this on, so that we can be part of the solution. We can be the voice, because we have, as part of the $4.7 billion, we have $24 million that we have to focus on a public awareness campaign. And the public awareness campaign is for everyone. So explaining what adverse childhood experiences are, and more importantly, where can you get the support, and what can you do, and why this is important to even pay attention to. So I can tell you, with the Hispanic population, when I shared information with my patients, it didn't stop with them. It went to the whole community. And I'm hoping that this is what's going to happen with our public awareness campaign, that folks are going to share the information with everyone around them, and to say, hey, you know, you can get screened for adverse childhood experiences, and this is where you can actually get some support, so that you can mitigate those negative impacts, those negative experiences, to help build up the resiliency that we know works, so that you can have that more positive, healthier trajectory for the rest of your life.
Terrific. And a little plug here, we often see in campaigns that they're targeted on children and adults. So if you could add in elders too.
Absolutely. I can
I'd be
already
very
see a
pleased.
grandmother, grandfather,
Okay,
you
good.
know, with the child. Absolutely. Thank you for giving me that plug. My chief of communications is in the back, and
Okay,
she's
good.
writing,
Plug in
she's
for the
writing that
elders.
down. Yes.
Speaking of which, so older adults have been impacted. Well, actually, every age group has been impacted by COVID-19, as you mentioned. As the pandemic continues now in its third year, we're seeing that people over 70 are now at an all-time high in terms of hospitalizations. So they account for 90% of hospitalizations right now, and we're just entering surge phase. You know, California did a good job in COVID-19 compared to many states, and also learned a lot. So can you tell us a little bit about what the state has learned that might help us in the unfortunate reality of upcoming pandemics?
Yes. Yeah. So lessons learned, I think, on all fronts, but more importantly, really learning the lessons of prioritizing and continuing to prioritize our aging population. Before the pandemic, the governor had already commissioned a master plan for aging, along with investing millions of dollars in an Alzheimer's task force. I know you're going to be hearing from Maria Shriver tomorrow. She's the lead on that. And so really, when the pandemic hit, we realized, wow, we have to pivot, and we have to take into consideration the reality that more folks are living alone. 1/3 of folks are living alone, that there maybe is not enough access to the housing. And so all of the pandemic experiences were taking into consideration when the master plan for aging was being developed. And because of that, there is even more of a strong emphasis on 5 areas and 23 action items. But the 5 areas for the master plan on aging is focusing on housing. We've already heard the importance of housing, focusing on equity, the fact that not everyone is impacted the same, that we all have different social determinants of health in terms of how we experience life. The other is, as well as the caregivers, right? I learned so much as the overseeing the Alzheimer's program, and personally in caring for my great grandmother and my mom too right now, and just realizing that caregivers are a critical component of our aging population. And the other area of focus is the economic, because economic is also such a critically important piece in having folks live independently, their sustainability, access to the food, to the housing, to the various programs that there are. So the governor really has, through his commission of the Master Plan of Aging, took all of the COVID experiences into hand and realized, okay, this is where we have to really focus on. And the other piece that I left out is healthcare, right? Reimagining and redefining what healthcare is like. Realizing that COVID made us aware that depending upon where you are, about a third of people over 65 don't have access to the internet. So even though we may have this wonderful telemedicine, access to virtual healthcare, virtual services, for 1/3 of the population who are over 65, that's not a reality. So the governor has invested millions of dollars in establishing and breaking down that digital divide, and that work has already been started. So again, COVID just made us realize we have a lot of work to do, but because we are here in California, and I love to say, as California goes, so goes the rest of the nation. People are watching us here in California to show them how we create health, how we reinvent health. And it really has been a lot of the investments, financial investments, the input from the cross-collaborative partners, from public-private partnership, community organizations, stakeholders that have made a difference in directing how California is moving forward with the aging population. You know, all of us, including myself, when I saw the age range, I thought, okay, I'm one of these people now, which is wonderful. You know, we're redefining and what aging looks like, and I just like to think that we're in California also. Fine wine, like fine wine, we're all getting better. So.
Excellent. So maybe I sort of missed this, but is your office directly involved in the master plan? It's an interesting thing. Not everybody may realize there is this master plan, and it seems like how it's being implemented varies a little bit community to community. So I'd love to hear more about how the Surgeon General is part of that.
Sure. So the master plan on aging focuses on the 5 areas I mentioned. But again, it is a cross-collaborative initiative, and going back to where can prevention happen? So that's the public health hat that I wear. Where can prevention actually happen? That's where the adverse childhood experiences initiative that my office is leading comes into play. So if you want to find the seed, if you want to really go down to the core action item on where can we make a difference, that would be the adverse childhood experiences. You can go on ACEs Aware and become certified to evaluate somebody who has had adverse childhood experiences. We've had over 1 million people in California already been screened for adverse childhood experiences. So my office specifically is focusing on the training that was created by Dr. Nadine Burke-Harris. She led that, and that was part of her initiative as Surgeon General. And the other piece that we're continuing on is not only that public awareness campaign, but the $1 million on education for educators focusing on adverse childhood experiences. So specifically targeting 0 to 12th grade instructors and really helping them become aware, because of the fact that kids spend more hours at school than they do at home, that, oh my, maybe that child is experiencing an adverse childhood experience. Maybe there's abuse, maybe there's neglect, the parents are going through a separation. All of those cause negative impact for the child. And to help that educator provide support or direct the parents or the child to support is going to be critically important. So that's what we're working on. But it is that adverse childhood experience, which is the common denominator. I see it for improving our aging and also our overall health in general.
Great. I want to leave time for questions. So maybe just one more from me,
Sure.
which is, what do you think are the biggest challenges? I mean, doubtless we've already touched on them, but for California, maybe any we haven't mentioned so far, as we, head into winter virus, season and into, we're getting close to the second half of dealing with Healthy People 2030. And I'm wondering how California is fitting into that picture and whether our challenges are the same as the national challenges or slightly different.
So I think the challenges are probably the same, but because California has been so innovative in really pulling in those public-private partnerships, community stakeholders, I think we're more advanced in the solutions. And that's fantastic. Being on some national advisory boards and seeing some of the recommendations, it's great for me to say, well, California's already doing that. We're already leading that. And so it's fantastic. But I think one of the biggest opportunities we have is really focusing on equity dealing at all levels in terms of health outcomes, in terms of health access, equity for education, for information, being able to understand your health process, your health issues. The importance of prevention is so critically important. As a fully Mexican American bilingual physician, I have been the voice to the Spanish public over my entire career, because people like to hear the message from somebody that looks like them. They like to, it just builds rapport, it builds trust. And that's one of the biggest opportunities we have here in California, is that we are so diverse. I love looking around this room and seeing the diversity of the people that is represented here, from the very young to older, more experienced people, and all the diversity of cultures. So I think bringing that equity is really critically important. California is already doing it. We are leading the way, but I think we can do a lot more in all of that work.
Terrific. So any questions from the audience? There's one right there. I think somebody brings you a microphone. It's coming.
Hi, thank you. Is this on? Thank you so much for what you said. I'm concerned. I have a podcast, and the more people that we interview say they can't even get a doctor's appointment these days. So I think it's just the shortage of doctors. And then we talked to Dr. Aronson on the podcast, as well as you get your 15 minutes and you're out. So to me, that's another major problem of healthcare.
I'm glad you brought that up, because as a physician who was only given 15 minutes, if I was lucky, to see a patient, because there's a room full of patients and patients need to be seen. And as a public health leader, knowing that prevention is key, one of my biggest areas of focus and just sharing is the fact that 80% of healthcare happens outside of the doctor's office. And this is something that I am really trying to bring light to. The fact that those 10, 15 minutes in front of me is not going to make really that big of a difference in your healthcare. Maybe you'll get a prescription and you'll feel better, but it really is the health that's happening outside of the community that is going to be more impactful. So the fact that you can have a victory garden and be able to communicate with people in your area, the fact that you can perhaps do, and I see the exercise, you can walk with somebody, your loved one at home. And even one of the things that I really promote is just moving. If you can dance in your living room, if you can have a dance party with your grandchildren, do it. Health happens outside of the doctor's office. And I think that's where we have to start changing our paradigm on what health is and how we actually stay healthy. It's not the doctor's office. It's going to be what's happening outside of the doctor's office. And I think as you'll see soon enough, with all of the reinvestments in reimagining what mental health is going to be looking like, really implementing the master plan on aging, you're going to start to see how communities, how cities, how different cultural groups are being tapped into to tell us what works for you. There's a Healthy Brain initiative that is being funded not only in California, but nationally, that really pulls on the local communities to say, what is the best way that we can improve the aging issues in rural counties in San Diego? So thank you for bringing that up and for helping me promote the fact that 80% happens outside of the doctor's office.
And it's true that the 20% is not doing very well right now, but we're all working hard on that.
Yes.
They're just, yeah. Another question.
Dr. Ramos, thank you so much for really articulating a wonderful lifespan perspective on healthy aging. I suppose I have two questions. The first is, any innovative models in California that are incentivizing more medical students to go into geriatrics is one. And then the second, and that dovetails with the first question. And the second question is, ageism is alive and well. We see it in employment, we see it in housing, and we certainly see it with healthcare. And so what is California doing in order to address some of the ageist stereotypes that so many of our providers have?
So in terms of promoting geriatrics in medical school as an adjunct faculty at Keck USC, I can tell you that we try to incorporate the whole lifespan. At least I do with my medical students that are assigned to me, the whole lifespan on how is this impacting not only right now, maybe somebody that is a reproductive age, how is this going to impact the person when they get older, as they age? What are the things that we need to take into consideration? I don't think we can ever train enough geriatricians. I think the approach should be, and I heard earlier that there is somebody in the room that is working on incorporating geriatric curriculum into everything during medical school, into the subject, which I think is great, which is very similar to what's happening with equity in California. I know a lot of the medical schools are integrating equity, the disparities, the health outcomes into the curriculum just to increase the awareness, increase the realization. I love that idea of increasing the geriatric components of healthcare, because really, if we start to treat at the geriatric age, you're too late. It's got to start early on. And that's where I believe this is at Cross Collaborative. We need to pull in public health. We need to pull in the work that's already been started and be at that table so that you can articulate your version, your experience locally, and help shape what the solutions are going to be in your area. I encourage that of all of you, because everybody lives in a different environment and the solutions are going to be very different depending upon where you are, who you are, and what your culture is. In terms of ageism and discrimination, be it with all of the shortages, and you keep on hearing burnout, right? Burnout from nurses, burnout from physicians, burnout from teachers, every single sector. I think this is an opportunity for the aging population to really lead what the workforce is going to look like. And when I was getting my MBA, I was involved with a lot of entrepreneurship development. And one of the areas that we were encouraged to tap into was the aging population, because we didn't have to pay for health insurance, right? And that is something that a lot of folks don't realize. So you have now somebody that has experience, that has health insurance, and that wants to work, right? May not want to work full time, but now nobody wants to work full time. So how different are they? Right. So this is the opportunity to say, this is the experience that you need. I have it, and I'm here. I think it's another paradigm shift that we have an opportunity to change.
Terrific. I think we're actually over time, so I need to have us wrap up. So apologies to the person who had a question over there, but thank you so much for coming today.
Thank you for all your work too.